you're our workers, you're our colleagues. Every single one of you makes me proud to be part of our health service. And the people who staff our wards, the people who are here today, well, we all know what it's like to work in the health service, and we know that the crisis that we face together is real. We know that within 5 years, the NHS in England alone, every single year, is going to be £30 billion in the red. We already spend a lower share of our national income on health than France, Germany or Spain. We've got fewer doctors per head than Hungary, Poland or the Czech Republic. And the government reforms that are meant to solve this, well, they're not helping the NHS, they're harming the NHS. The government are less interested in solving the problems we face in our day-to-day working lives and much more interested in shifting the blame onto us. Well, I'm sick of having to say I'm sorry for the things that simply aren't my fault at work. I'm sick of having to apologise for the broken promises of our politicians. And every day I see the problems caused by a lack of funding in our health service. Why are we having to apologise for the broken promises of our politicians? The government, this government, is trying to abandon its responsibility for providing universal healthcare at every opportunity. And despite the lazy caricatures of our doctors, our nurses, our porters, those who are there every day of the week, providing a 7-day health service, well, they're trying to just destroy our reputation. They don't care about us. Since the inception of the NHS, we've had hospitals up and down the country providing emergency and urgent care. This weekend, next weekend, and every weekend since the inception of the health service. Ask anyone though, ask anyone here today, and we can all tell you that the way the NHS is funded on Monday through Friday is not the same on a Saturday or a Sunday. And yet the government that claims to want a 24/7 health service, well, they say that with one breath, and in the next breath, they're inflicting the severest cuts on our health service that it's had in its entire history. Well, if the government wants a truly 7-day health service, they've got to pay for it. They found the money for the banks, and now it's time to find the money for the NHS.
But instead of investing money in the NHS, the government seems hell-bent on plugging their deficits by chipping away at their NHS workers' pay and their goodwill. At the current time, the government wants to impose a new contract for junior doctors, which removes key hours safeguards protecting us and our patients, which financially penalises trainees from undergoing additional training, and which reduces pay for working at weekends. Their aim is simple. They want to get their staff to work longer hours for less pay with fewer resources and to destroy the existence of a safe and effective NHS. In the face of a government that just won't listen to us, last week we said no to re-entering talks about the junior doctors' contract. Let's be clear, there was no negotiation on offer. This is and remains an imposition. The government's intentions are clear. Junior doctors are simply the first item of their misguided reform agenda. And we know that they want to do this across all healthcare worker groups. This is why we have to stand together. So on Monday, we will be launching the first phase of our campaign to ensure that junior doctors get a contract that values their work and protects their patients. We want junior doctors, we want the UK's 50,000 junior doctors to give us the reasons on Twitter and on Facebook to explain what the government's proposals mean to them and how they will affect them. We don't just want that, we want those of you who've been doctors, junior doctors, those who aspire to be junior doctors and those who work with junior doctors to join in too, and to all speak out together about the government's plans for reform which affect all of us. Our campaign launches next week. This isn't about our campaign, this is about today. And today is about healthcare workers standing united with the public who we know support us too, to save our NHS. Despite the challenges we face together, we have made the NHS the most effective healthcare system in the developed world. We know that. But the government is trying to set us up to fail. cannot and we must not let that happen. Thank you very much for having us here today.